And for our next speaker we have coming up here, I would like to introduce one of my favorite professors that I have, Dr. Alex Grieco.
Awesome. Bucky, I thought you were going to have me speak, not your favorite professor. Am I later? Okay, so we're good. No, so nice to be here. Give me 1 second for I have the dreaded slide set to show up, but hopefully not too onerous here. Give me 1 second to see if the Zoom screen share is letting me. I think we're in good shape, and the sentiment goes back to Bucky. Can somebody give me a thumbs up if you're seeing a little slidage here? Doing it? Got some AIDS Quilt. Very good. Well, thank you so much. You know, to say it's an honor to get to be here with you today, to get to have any part in you know, this organization and in this type of event, that would be quite the understatement. And for our wonderful MCs for today, never want to forget how much you inspire your instructors, the people that are lucky enough to be here and be with you and learn from you. So today, for a little bit of time here in this amazing, absolutely powerful event, the Virtual AIDS Quilt Conference, I was honored when Bucky asked me to speak on you know, a topic that was close to my heart, and I'll show that in a tangible sense very soon. The power of images. And as she said, my name is Alex Grieco, and if you take any class with me for anything, you know, and that goes for the med school, for the undergrad courses I'm a part of, and very lucky enough. This is what we do. I like people to call me my first name. This would be my proverbial name tag. This is less of a visual since we've been online for a minute, but I think the fact remains, my name's Alex, and if anybody who's on the panel, whether you have your video on, video off, and may not you know, get to cross paths until we get a little bit more full-time on campus, if we ever run into each other, come right up. That's what I want you to call me, and if you want to email me in the meantime, there we go. I know a lot of times we say thank you at the end, right? And when we wrap up something, and that's the time that we would go and say, well, thank you to everybody. I want to start with that. For the members of SDES, you know, back at Bucknell, we had nothing like this. And I think it's really powerful that people are not only given their time, but their talent and their expertise to making something like this possible. I'm going to right back at you, Bucky. This was pre-programmed in the slides, so you know it's legit. I want to say the amazing Bucky Foster, who, you know, if you ever pause for a minute in the middle of a lot of different intersecting challenges that I think people experience over time, some related to that infectious agent that we're gradually getting a win over, several of those actually. What, you know, keeping going forward, what empowers you, what keeps your battery charged, etc. It's getting to work with people like Bucky, and who you're so assured each and every day that you step into a space and know, you know, the fight is going to go on. I'm not going to say it's not a fight, but we have some amazing people carrying that forward. Our other speakers and panelists. I try to hang back and not, you know, I'm that one person who Zoom always like jumps in and like spotlights and do that. Amazing speakers, and I'll try to avoid that later today when I pop in and out for things. And of course, thinking about what today is, the reason that we're here on a very sunny Friday in April. But gratitude to the many individuals who won't get to thank, and I think we can see where that would be going in terms of the AIDS quilt. And I'm also referring to the people, not simply those honored by the AIDS Memorial Quilt, but by the people that conceptualize that as a tangible reminder for all of us, regardless of what decade we find ourselves in, and those that took the time to put that together and to share with us the memories that we're getting to see parts of and to take into our own heart. So always probably reasonable. Somebody said whenever you meet a new group, just say a little bit about what you do. I won't read off the slide, I promise. I do a couple things over at the College of Medicine. They keep me busy, and I love every one of these things that I get to do. What I'm talking about with you today, though, is, you know, the power of images, and no small coincidence that, you know, when we think of something, it could be an image that we have in our head. It could be an image of something that's around us that we've seen many a time, maybe worn ourselves, something that we can touch in our hand like a red ribbon folded in a a certain way. I think the magical part, one of the many magical elements of getting to be human and getting to be in a space, however you want to define that, a safe space, a brave space, a learning space, being at the Ohio State. I think one of the magic parts of that is that you're able to join with people and look at the same image and be able to interpret it a little bit differently sometimes. And we're looking at something I'm sure everybody is familiar with and thinking about the red ribbon. And I'll be honest with you, I wish I could say and lead in with, well, the first time I saw this red ribbon, you know, and what it meant. I can't say that because I think it's always been something my family, you know, wore and embraced proudly. My parents are pretty amazing in that regard, and I'm lucky. I have been told before by several people that I see the world a little differently. And after talking with me for any length of time, whether I want you to know that or not, I think that's going to be pretty apparent. And so, as I think my friends would testify very loudly, yep, Alex sees things with a little difference. And how beautiful and amazing and awesome to be able to be in medicine, to be a physician, and to be able to do that for a living. And to take something that you might be a little familiar with before, take a little impressionism, little pen and ink, whatever, and turn this into how you practice. And what it is that you do for people with your medical training, with going to a place, Bucknell, ever so slightly smaller than Ohio State, just a little bit. There's the visual for you, ever so a little bit. You know, my whole hometown could fit approximately 7 times into the horseshoe. Going with that, and we're looking at a film, maybe several of us, I know I have on the panel here, taken today, have had a chest radiograph. And you know, I think that was one of our first tangible examples, a lot of us, for thinking about how we look at each other from that sense of seeing inside the person. That's one way. It's one way to see inside the person. And when you talk about the heart and lungs of physiology, right? And you know, that's certainly one way to do it. I think there's a lot of different ways to look at that and go. Now, you know, come on, I'm a radiology person. I have to be a little bit techie and nerdy and show you some other things that I do on a daily basis. And this is sort of a little schematic cartoon, whatever, of a CT scanner that's a whole other way to look inside the body.
Can you share screen again? I think it just hopped off.
Did it just hop off? Oh no, Bucky, I'm so sorry. Hold on one second. And my computer is not helping me here. Hold on one sec. This is what we'll do. I will stop the old screen sharing and see if I can start this again. Sorry, y'all. My computer's been way better behaved than that. And if not, hold on one second here. Bucky, how are we now?
Perfect. We can see it now.
Seeing something. Okay, so sorry about that, everybody. See, that's what I get for saying my Zoom is working. So CAT scanner right here, and just looking up, we move forward to something that we're thinking about. Now, you might not have looked at too many of these before, right? As another way to see inside the heart and lungs. But if you look right here and see where we're having a little artificial intelligence help us, that's a loaded term in a lot of ways. And what you're seeing is what I tend to do in my mind is I tend to use the elements that I love from art and being able to put that into what I do every day. And what you're actually seeing over on the right side is something that wasn't available back in the middle to late 1980s, the early 1990s, when trying to diagnose and figure out what it was that this group of individuals, granted of a certain you know, sexual orientation, gender identity, etc., were coping with and dealing with in their lungs. That was this first recognition of a disease that we're honoring today in the ways that we're trying to fight it and honor by connecting about this. And that's artificial intelligence finding not evidence of one of the many, many different active types of pulmonary infections that can be related to HIV/AIDS, but something that's been also very tangible for us in the last year plus. That is the radiological manifestation of SARS-CoV-2. And the reason I'm showing this is that before there was that push for understanding at a deeper level what happens to people's lungs and heart and everything in the setting of HIV/AIDS, radiology even related differently to those very images that we carry around in our minds. Now, actually, my fellowship, when I went on, I cranked up the nerd factor a little bit more yet. I know you're thinking, how is that possible? I can make that possible. So we're getting a little schematic and showing some applications of MRI right here. How much can we look inside somebody? This is a normal, totally normal, thankfully, beating heart. And, you know, I couldn't help thinking sometimes in being able to have this view of someone that's coming in maybe on a fine day, maybe on a not so good day, when they've had some symptoms or some concerning things that have happened to them, and be able to say, this is what I as a radiologist can step in and try to help you do by how I'm able to see you and how I'm able to help those clinicians to care for patients with disease of the heart, the lungs, everything. And if you want to nerd out with me sometime, pop me an email. We can talk about the physics of this particular cardiac MRI here that I spent a lot of time in my fellowship learning about. I would say let's momentarily leave the radiology suite. Let's get out of the reading room and tiptoe back a little bit. Let's say circa November 1990. Alex's kindergarten teacher sends a note home. That was not the first time and wouldn't be the last time. Let's say I got a little note sent home from school, and that's awesome because I have parents that are elementary teachers, so they're all over it anyways. The note had to do with a little exercise we did during the day that day in kindergarten, and our teacher, Mrs. Smith, hey Mrs. Smith, if you're listening, maybe not, but maybe, said, okay, boys and girls, tell me, we're having a little dialogue, little, group learning activity. What did Disney princesses do? Well, she said, what did princesses do? And with this type of visual, adding some princesses since that time. People said various things, and going back to the old Disney cartoon days. Got around to Alex, yours truly. Alex, what did princesses do? And this was my response that got me a note sent home to my parents. And I said, princesses remind AIDS patients that they are loved. And this was the princess I was talking about. Little before maybe the time, some people on a panel is pretty little, but who we're looking at here, working with, talking to, being one of the first public figures to hold the hands up, hug, give a little kiss to patients with HIV/AIDS. This is Diana, Princess of Wales. And, it was one of those things that, it's somebody that we lost long ago, way too soon, not terribly long in the big scheme of things after these pictures. But if you look over on that image on the left, somebody's sitting and talking with an individual who consented to that photo back during the time. I feel very strongly about that in saying all of these that you're seeing. And said, what is it like to sit next to and breathe the air that somebody with HIV is breathing in? Well, it's exactly like you see there. And you can think different things about the royal family, and some news since then, some positive, some not so positive. But this is one of that first times that the world got to see the way that you can connect with somebody suffering from a disease that practically hadn't even gotten a name yet. Princess Diana here, major fan now and always. Although at that time, I was kindergarten age, right? I knew who Princess Diana was. My parents, had pictures and everything like that. I knew Princess Diana was. Still couldn't relate to her, right? I didn't, I knew where she lived. I knew what she did. I couldn't relate to her. But there was another image that I absolutely 100% related to. And as Bucky knows, I wouldn't, now, come on. How can I be an OSU type instructor and not throw in a little in the moment quiz? I'm famous for such things, okay? This image right here is somebody I absolutely 100% could relate to in an absolutely major way. Very young, and we won't have a audience poll, that kind of thing. It's a Friday, come on. This was, people are guessing, 3, 2, 1. This is Ryan White, and he was this young man, Kokomo, Indiana, not too far from where we are, and his story absolutely just moved me so much. And I think, again, not divulging into, a big history lesson, etc., but through our learning in one of the many populations, it was not a single population, but many populations of individuals that suffered from HIV. His case was is a person with hemophilia, which is an inherited, a genetic type of a clotting problem with the blood, and so getting a lot of transfusions of clotting factors all the time before we knew anything about HIV and AIDS, and Ryan had HIV. And where the story came was when he's basically all like the equivalent of getting run out of town, run out of his school, and needing, just because he wanted to go and wanted to sit in those classrooms that we all want to get back to right now after being a year virtual practically, and sit there and listen to an instructor in the front give PowerPoint slides. Not really at that time, but you get the picture. It's him, and is thrust into the limelight. And he said, I'm not a hero for anything. I just want to go to school. And he passed away long ago, 1990, after a very valiant battle with HIV/AIDS. Now, I think, as I mentioned, in a class that I'm fortunate enough to get to I say I teach the class because that's what the registrar likes me to say, but I would rather say that I learn in the class as the dude who just gets the Zoom ready. That's how I view it. And I have a couple of my wonderful class people here on the past and present on the call right now. So basically, in just thinking that this image really stuck with me, and when this person looks a little different now, okay, if you look up there, that is Jeannie White Ginder, got remarried. That's Ryan White's mom. And she came to OSU a few years ago, right when I was first getting started here. And people had heard say, "Oh yeah, this Ryan White's mom." And I'm remembering somebody that in some ways it was somebody who wouldn't have volunteered to be a hero, Ryan White, but somebody who certainly was in a lot of ways for me. And here's another hero, Jeannie Ginder, up in her 70s, 80s now. The whole idea was she's on Zoom, okay? She hasn't been stopped. And we think we can struggle with Zoom sometimes. There's Jeannie sharing her screen. That stuck in my mind. I think when we think about something that touches us and is in a very visual way, I told you that's what I do for a living in medicine. That's how I use everything I did when I was in undergrad, medical school, residency, beyond. Here's what I do, and I use this, and I still go back to the first time. Certainly wasn't on Google, right? But the first time I got to see part of the AIDS Memorial Quilt. And I remember it, and what, it's not in DC, it was, was a component of the AIDS Memorial Quilt, and I'm sure you've heard and looked up some different parts of that history today. It wasn't in this form. And for people that have been traveled, doesn't look like the mall we're used to, but this is the DC Mall. And there is, where the AIDS quilt was displayed, one of those few times when all of the pieces were together. And when you get the perspective, of being on a certain monument and looking toward a certain house of government, and reminds you just how many people are represented in the AIDS quilt, and something that touches me to this day, the ability that we can not only see what loved ones, family, whether given family or chosen family, put into making those squares, sewing, putting together colors and fabrics, so that it absolutely would not bring back the person. It would bring us to remember the need to bring ourselves into what we do also. If you've been around me, and I think a couple of my class people on the call can know this, been around me for, more than about 12 microseconds, I think you would guess that music and theater are pretty much a big part of my life. That was my, I like to say to my pre-med advisors back at Bucknell, bio was the other thing. That was like the fun thing, because, being almost a double major in musical theater and in bio. So how do we bring that in? Has another image that touches me and is there. Next quiz. Okay, everybody in class ready? Okay, get another little quiz for us. Get your audience response or just this ready. Individual on the screen here, a little different. Okay, a little different venue than we've seen before. Thank you, Freddie Mercury. And whether it's Bohemian Rhapsody or I love the chat. We're doing good with this stuff. Thank you for the chat. Whether we're talking about Bohemian Rhapsody, I Want It All. Take that any way that you want to, and we could certainly make that, whether it's a public health mission, whether that's a mission in the microbiology laboratory, the drug companies, to make affordable, available, accessible pharmacology to the individuals on this continent, on a continent about halfway around the world. There's different things we can keep in our mind for being heroes. And for obvious reasons you can see on the screen, waiting for those in-person Halloween parties to resume. Why would I show Freddie Mercury? Because whether you know him from a certain movie, thank you, Rami, for trying that out, or do you want to remember from amazing music? Remember the fight of his own battle with HIV, and another person, now I would say from the musical side, my parents were probably, they would lay claim, right? Cool. That's our era. Alex, stand back. We got it. That's us. What was mine? And maybe a little later of music, another image for us. Now we're going to flip it up because the quiz is boring if we keep doing the same. Now I'm going to give the author first, Jonathan Larson. Okay, give that a couple seconds. Ring a bell for anybody? Maybe some people on the screen. Maybe if you're the dueling nerd factor, myself, right? What do we got? Bio, theater together. I remember Rent. When Rent happened, and I was, and of course my poor parents were like the first in line at like our music store in town to get this, and because I needed it and to understand what this was, and hearing about it. Rent brought so many things, whether related to HIV/AIDS, homelessness, about what it was, and about seeing not just a living, breathing gay person or gay character, or potentially a gender diverse character, for example, but that, hey, yeah, we sing, we dance, we actually sing and dance about things other than HIV/AIDS. That was what I took away from Rent, and it was incredibly powerful to see that. Here, a couple characters of people in the note. There's some Mark and Roger. Note the guitar, that'll come into play in a second. Colin's an angel. When I saw Rent, after we went, of course, implored my parents to please, we got to go see this, Broadway, and then my parents asked afterwards, so Colin's an angel, Alex. Do you have any questions about that? Do you want to talk about that at all? They're super cool. I said yes. How did Angel learn all that choreography? And they're like, we're good. Okay, nice. And we can see, and thanks to a successful audition, got to play the part of Roger back in the day, and something that sticks with me quite a lot. Check it out if you haven't. Here's Seasons of Love. Now, I think that when we think about this now, moving up to 2021, a little bit before 2021, but not that long ago, based on the social medias platform here. It's a little blurry, I apologize, but we have to keep this in mind, okay? And that what this is up there, the bartender told me his high school did a performance of Rent where they couldn't say AIDS. Now, this is, again, and now you're saying, oh, yes, Alex, show your early 90s stuff. Thank you. Note with the social medias was not that long ago. We have a lot of work to do. We have some visibility work. We have some work to advance our cause and about being what is a very true and solid individual to carry this forward. I think that, when we do our work here and think about the world that we are, we don't ever want to be in that place where we can't say something. A lot of us are working to make that awareness better and be true. Maybe not what this individual is particularly going to apply this toward, but if people are familiar with the film critic Roger Ebert, just keep in mind as we face different challenging parts of a battle, resentment's just a way of letting someone else use your mind rent-free. So let's not. We'll power up, keep ourselves moving, and go forward. Okay, bring me in, man. Okay, so music, theater, medicine. I think we'll, again, opening up for the quiz capability here, going back to, no, certainly back a little pre my time, more than my parents, but guesses for who's up on the screen right here with a special significance. My bro Rocky, all right, in the city of bro love, if you will. Some things have changed since the days of Rocky back in Philadelphia, and I've been familiar with that city for a bit of time, and it's been good to me. I learned a lot, and I did a lot in the city of Philadelphia. That's not my first experience with Philadelphia. The first place I got to learn about it was, things that are very, very challenging. Again, yet a different way. Now, not thinking just about what HIV/AIDS does to people that we haven't seen or portrayed in real time. I'm talking about the deeply complex issues that can bring people together. And that's not just talking about here, our Andy Beckett, or, the different characters, Denzel Washington, Tom Hanks. There's different ways that this epidemic, and I still call it that epidemic, some people might not, but I would say it's something that keeps it in the forefront of our mind about what we need to and have to do. Yes, I'm the radiologist, right? And I'm going to come at it from this angle and some of the earliest pictures of what that was, that pneumocystis pneumonia. Got to see examples of that. That was from the earlier times, and we can treat this. We can help people now. I learned at my fellowship time in Philadelphia at these fine institutions right here, that a lot of what our key is for taking something that we learned from the past, from the different confluence of people and possibility that come together to do something positive. What we have to keep in mind is that you can go back to history, this little building right here where something was signed that put forth a couple ideas about what it means to be able to be free and to say things, such as in a little picket line out in front of that building. I just want to point this out. Independence Hall in Philadelphia. This was 1965, as in about 4 years pre-Stonewall. Stonewall is a big date for awareness for us in a lot of different ways. But just keeping in mind that that some of this was sitting back in that city of brotherly love, where I found myself. Get ready to wrap it up here shortly. My images, when I think of Philadelphia, I think like this. I think of that pride and all. I want everybody to look at those different flags. Might not have always been that way. Maybe we still have a place to go to bring those together, bring it up, and help each other to really get to this point where we can make this mean the most for all of us together. Now, the people who signed the little document in this building, I don't know if they would have envisioned this exactly, for a few different reasons, like this little version that we have. As they say on that old match, it's all in the perspective. If you're wondering how I prepare for Pride, this would be that example right here. So bringing us into the close, right? Music, theater, medicine. I told you what I do, and my love in getting to be here and do this brings us to one place where teamwork matters, where you need the power of the team. For some, that tends to collect in a bit of a horseshoe that we have up the road from where I'm broadcasting to you right now. Here's another space where we need some team and need some work together. And I quote, "How is a radiologist going to teach a class called LGBTQ plus health?" We're making it work. Carrying forward a little dream, as I love to share with people. I love this picture. It's one of my favorite images. Very powerful in a number of ways. Thank you, Brutus, for the guest cameo. But remembering that we can never leave from here. Thank you to the many people, Bucky and the whole crew, that made this available to us today to be thinking about. We never want to lose in our celebration of what pride means, of what it means for everybody, every shade and color of that rainbow, as cheesy as that might sound, because that is what we have to do going forward. If we put our work together, we can get the answer as told to us by the final quiz question, that little quote that some people might remember, the late great, who happened to say this, not classically considered a member of the LGBTQ plus community, but as people who are on this call that have been in my class and have heard me say approximately 70,000 times by this point in the semester, if you're in that class, welcome to the acronym, because as RBG would say, you're an ally. I want to thank you to everybody. Thank you for being here, for giving your heart and your mind and your thoughts, your ears to this. Thank you to Bucky, and I will get out of the way for our next crew to come up and give you what I believe is a panel. So thank you so much.
Alex, that was so wonderful. So much for your time and all of your teachings. I know there's a lot of us on right now that are your students, and we adore you. So thank you so much for all you do.
Thank you. Thank you for giving me a job, Bucky. I mean, I'd be, I like something to do. I don't like to be bored, obviously. So with that, I want to say thank you. I'm going to camera off to get out the way. And please, though, and I'll put right before I go, I'll do that. If anybody would like it, Bucky, and I'm already sorry for being a minute over, I will put my email into the chat if anybody would like that. Everybody take care, be safe, be well.
Thank you.